Doctors get each other. I have so many friends who married non-physicians and it didn't work out. Married to a physician, you get each other. You know the routine.
What did you think being married to another doctor would be like?
I thought it would be amazing. It turned out to be even better than I thought.
You watched me take these scary swings. What does support look like when money was so tight, but the vision was so clear?
It was difficult, I admit. You wanted to change the world, and I thought that was amazing. So whatever it took, and it turned out amazing.
We didn't think our lives would cross that much. As an oncologist and a gynecologist,
when someone has beaten their cancer, we pat each other on the back. Meanwhile, the treatment wreaks so much havoc. Their sex life is destroyed. I learned about the benefits of estrogen, about menopause, and how it factors into oncology. It helped me counsel my patients even better.
What's one belief about marriage and medicine that you think people should retire?
What I've learned over the years is that
all right, guys, today 2 doctors, 1 marriage, 3 calendars, and a mission that doesn't clock out ever. Today we're talking about what partnership looks like when both people take care of other people for a living. Today I get to introduce someone I know in 2 ways. Dr. Irfan Firdaus is a medical oncologist with the Christ Hospital Physicians here in Cincinnati, where we call home. Thanks to him, he treats a full range of cancers with a special focus on GI cancers. And he's been a principal investigator on GI cancer clinical trials, presenting his work at major meetings. He also cares for gynecologic and genitourinary cancers, including ovarian and prostate. He trained at Des Moines University, completed residency at Lutheran General, and a medical oncology fellowship at the University of Cincinnati. And he spent decades serving patients across our region. He's a clinician, a teacher, an unbelievable father, and he happens to be my hubs. And I'll tell you right now, and I hope this makes the edit, he is a behind the scenes type of guy. So this is going to be really interesting and a true labor of love. So let's get into the beginning.
Sure. Yeah.
So when we first started dating, what did you think being married to another doctor would be like?
I mean, I thought it would be amazing. We're both so driven, career-oriented. It turned out to be even better than I thought. You know, it was going to be hard for sure with our hours and everything, but I think we understand each other. Doctors get each other. So they know the lifestyle. They know the routine. They understand what the hours are like. So I think it's good. I have so many friends who married non-physicians and it didn't work out. I think married to a physician, you get each other. You know the routine.
So I remember a story. You guys all know I'm a firm believer in coaching and therapy, and we've been married 30 years this year. So of course, there's been help along the way because there's ups and downs. And I remember complaining one time because I was like, how do I complain if he's late or he misses something, which is rare, because he's dealing with stage 4 cancer. And how do you ever compete with that? And the therapist gave me the best line ever. She was like, you're never going to win that argument because he's not out golfing or doing something for himself. She's like, you are allowed to ask him to be present as your husband and not always as the oncologist. But he's right. It's that level of understanding. I had surgery recently and he worked and I was okay with it. I mean, he came up and down to see me, but I didn't want patients to have to cancel their cancer treatments while I was having a minor procedure. And by the way, while I was in labor with at least one of the 3, he was also rounding.
I call that multitasking because I was there anyway.
But
I didn't miss anything, and I still was able to take care of some people along the way.
Yeah, you were. But our third child, I showed up 8 centimeters, and he was like dressed in his white coat and ready to go downstairs. And the nurses are like, "What are you doing?" And he's like, "Oh, I'm going to go make quick rounds." They're like, "This is baby number 3, and she's 8 centimeters. She was born like 20 minutes after we got to the hospital." In my
defense, there were multiple false alarms. So that was the third labor for our third child, including 2 false alarms. So I was just being prepared.
I guess apparently this is why I retired from obstetrics. I did it for a decade. I'm really good at diagnosing other people's labor, but apparently my own, I wasn't so sharp at that one. Name a moment early on where we knew, or where you knew, that we could carry the weight of these big careers that we had signed up for, but still be us.
I think there's multiple moments, just having children. I think when we didn't have kids for the first 5 years, we were in training. It was difficult. We never saw each other. We lived apart. I thought making it through that, and then finally, living together, creating our family, getting through those early years, I knew right away that we were going to be fine. Because we were in the trenches, both training and then starting our family. That moment I was like, okay, we made it through training, and we're going to have kids now. We're going to start our family. I knew then things were going to be great.
I think for me, it was, even in the darkest of times when we had no money and we could barely afford our bills, we laughed almost every single day. There's one of the worst pranks I ever played on him. I had been on call, and Irfan did actually more diaper changing than I did. Because being on call as an OBGYN, you usually spend the night in the hospital. He was on call. He rarely gets called in, but he's there all day. So he had a habit of not putting our son on the changing table and clipping him in. And so gentle reminders wouldn't work. And so finally, I decided that I was going to teach him a lesson. And so I snuck into the nursery. I picked up our son off of the changing table and gently placed him on the floor. And Irfan is like the kindest human being in the world. He doesn't have a mean bone in his body. And he walks in, and then I hid in the closet. He walks in and he's like, "Oh my God, poor baby." And then I didn't let him suffer any longer. I popped out and I was like, "I told you." And he was like, "Oh my God, I cannot believe that you did that." But I think it's those early moments of laughter, bonding over the lack of sleep, and just being true partners and helping each other through and not judging each other, I think was when I knew that we were going to make it. And just, I think, gratitude.
Yeah.
We were always grateful, whether we were eating Kraft macaroni cheese and stovetop stuffing, or just had a really cool bike ride and we weren't working. I think because he sees people at their sickest, when they're stripped of everything material, you really, really appreciate life. And I think that's when we knew that we were going to be able to handle the careers.
For sure. Yeah.
And the kids.
Yeah, definitely. No, I agree with that. And that was a mean joke.
It was a mean joke. So now we know who the nice one is in the relationship.
I think they already knew that.
So what does a good day look like us for at home, and signs that our systems are working?
Well, I think, we have family meetings, we communicate. I think that's important with our hours and all your meetings, your travel, my on-call schedule, our weekly meeting to kind of know what the week's going to be like is good. Our kids completely understand the dual doctor-parent relationship. They get it. They know we're not around as much. They have learned over time to to figure things out and be more resourceful at home. So I think we had it figured out really well early, and we had a good system. We watched each other's backs. When one was out, the other one picked up, and vice versa. So it was good. I think we figured it out. And a lot of things went wrong, but we figured it out on the fly.
I think you learn, I always say this, you learn a lot more from your mistakes than your successes.
Oh, 100%.
But I think our non-negotiables from the beginning was date nights.
Yeah.
Because it made us better parents and doctors, and made us just feel human.
Right.
I think our other non-negotiables were dinner at least 4 or 5 times a week together as a family. And that was no TV unless there's a sporting event on, God forbid. But no TV, no phones, like nothing. And really, we learned that even if we didn't have all the hours and we weren't the parents that were at the field trips, that the time we spent with the children was going to be very
quality
engaged.
Time, yeah.
Yes, we knew what was going on with them. And then the third thing was, I think, what has bonded us incredibly is family vacations.
Yeah.
And it doesn't have to be fancy, but just traveling together, having new experiences. It not only bounded us as parents, but the unit of 5, and the kids still talk about it, and our walls are covered with world travels. And we really decided to use the globe as a teacher for our children. And I'll say the other system that works for us, a family meeting sounds so boring. Okay. So we decided to make it fun with either a really good meal or a really good bottle of wine, and just sit and plan out our week and be like, okay, I'm going to be gone. I'm going here. I'm doing this. And trying to understand what each of us is doing. And I think the other thing that we also said was, no shop talk at the dinner table. Like the kids didn't want to hear about our patients or our difficult surgeries or anything like that. What is the superpower of a physician-physician household?
I think there's many, obviously you have to be engaged. You have to be able to leave work at work. And when you come home, you have to be the spouse and the parent, and it's hard. Sometimes the subject matter at work can be heavy, for both of us, a surgery that wasn't as good as you expected, an outcome that wasn't as good as you expected. And it's been challenging, I think, to leave work at work and come home and be the family man, be the husband. And that took a lot of time to figure that out, for me at least. But I think the superpower is just having that ability to draw the line, and when you walk in, be present, be where your feet are, so to speak. So
I love that saying. Say that again.
Be where your feet are. It's a great book written by the 76ers CEO. And it just about being present, about being where you are. And when you're at work, you're at work. You should be focused on that. But when you leave work, you should be present and do your best job to be there for your family, and unwind. I mean, just face it, we both have to unwind when we get home. Sometimes work does follow you home. You're charting, you're thinking about patients, you're thinking about what you should have done differently or what you could have done differently. But I think having that ability to draw the line and just be present is what you have to be.
So since you got the success is coming home and feeling really good about what you've done, right?
Yeah.
The trap is not being able to let go of work. And that's been a trap for me too, whether it was as a doctor, as a surgeon, as an obstetrician, or as an entrepreneur. But I would joke about the other thing where we are so different. So anytime I was learning about any disease process, whether it was dermatology, orthopedics, neurology, I was convinced I got it, or one of the kids has it. Irfan will a kid will have to have a digit hanging off before he thinks it's anything, because he's so used to dealing with the sickest of the sick. And so the kids joke that they literally have to have something dangling off of them before their father will take it seriously. Meanwhile, mom will turn any small problem into a tumor. And so we also have to balance that, because if it were up to me, the children will be getting, whole body MRIs, on a yearly basis. So being with a dreamer, we talk about this a lot. Yeah. So to me, dreaming is a form of planning. And I learned early on that as a child that I was a dreamer. But as a doctor, for a very long time, I followed a very traditional route. I watched my mother get sick. I was like, oh, I'm good at science and math. I want to be a doctor. I want to fix the women's healthcare system. And then I decided I was going to open my own practice, because you told me I'd drive you crazy if I stayed home. And then found women coming from 35 states and 3 countries and decided to found this company. But you're the one that was steady. And, I saw this quote that your partner either fuels you or messes you up. And so he was my original investor, but he's also been the roots to my wings. And so what do you always joke that are the scariest words in the English language?
I have an idea.
And what do you usually say? What is this going to cost me? And what else? Where are we going? But you watched me take these super scary swings, right? Building clinics, raising capital, pivoting my business model. What does support look like when the money was so tight, but the vision was so clear?
I mean, it was difficult. I admit, doctors, I think, are kind of pigeonholed into these traditional roles. You go to med school, you go out to take care of people, and many fall into that traditional role, but some don't. I mean, I think you paid your dues, you caught babies, you took care of women for decades, but you figured out that wasn't for you. You wanted to be an advocate. You wanted education. You wanted to change the world and create, a bigger thing. And I saw that, and I was like, that's amazing. That's not something I could do. I was born to be in the trenches, taking care of people and making my difference there. But you did that and you wanted to do more. And I saw that and I thought that was amazing. So whatever it took from our household to do that is what I wanted to do for you. And we were blessed because we had the ability to do that, and pivot on a fly, clean out some of our 401k, which wasn't advisable, but we did it anyway.
Yeah, because if you're going to bet on someone,
you take a risk. You take a risk. So we took the risk, and I wouldn't have changed a thing. I think it was amazing. But again, we had the ability to do it, so we took that swing, and it turned out amazing. I wouldn't change a thing.
When I first decided, though, to leave my steady job and open Her MD, what was your thought? And then how did you feel a couple months later?
Well, I'll be honest, I missed that paycheck since I'm the one who does the finances, and it was nice having a steady paycheck every 2 weeks. When that disappeared, I was like, okay, well, we'll figure it out.
And when you're a founder, people don't realize you actually pay to go to work. At first.
Yeah.
Yes.
There's no income coming in, but you got to think about the big picture, the greater good, as I like to say. It's all about the change you wanted to make, and also about happiness and fulfillment, right? I mean, you don't become a doctor just to not be happy and be in the trenches all the time. And I knew that you didn't want to do that. So it was something that I wasn't really worried about. It was stressful. I get it. I'd be lying if it wasn't stressful. But I think it did. It was something that I wanted you to do, and it was amazing.
It was stressful for me because when your partner believes in you so much, there's that added pressure. But I was still seeing patients. I just wasn't delivering babies anymore. Now I've completely pivoted out of patient care and very excited about what I'm doing, working on a book and doing the podcast and educating and advocating. I feel like life has given me all these opportunities, but you've given me the ability to take chances and take time to build that because it doesn't happen overnight. And so on call, late cases, kids, logistics, I'm traveling. My son had surgery while I was out of town because he hurt his knee, but we're managing all this. So what's our rule when our calendars break?
I mean, I think we're also blessed. We have help, and our kids are older, and you know, they can manage a lot of things on their own. We've taught them well, I think, and it's good. I feel like we have the framework to know. We have that weekly meeting. We have figured out who's going to cover what. I try to make every single event that I can. I move my schedule around as best as we can. We use time off wisely. So it's a day-to-day thing. I don't think there's any perfect answer here. I think you just have to adapt, the ability to adapt on the fly. When something goes wrong, moving patients around to be somewhere, or you know, your flight is delayed. Figuring out, what we're going to do. I think it's important. And we don't have family around to cover a lot of our things in Cincinnati. They're close, but they're not close enough to cover something on the fly. So I think it's just it's a work in progress. You figure it out day by day.
I think for me, it's about perspective as well. I'm definitely the one that gets worked up more quickly. But you have a surgeon's mindset and an oncologist's mindset. And we're so used to dealing with things that are very, very serious. And a lot of times he'll put things in perspective for me and say, hey, anyone I've met today or talked with would in a heartbeat trade our problems or our issues that we're dealing with for theirs. And so I think it's perspective. It's really learning early on what's important and what's worth your energy.
Yes.
But I think for us, the thing that he protects for us and for our children is time. We do not give up vacation time, time off, events that are very important to the children. Those are non-negotiables. I will schedule my trips around that, or my speaking engagements. We have always made sure we had an equestrian, we had a soccer player, we had an actress, and now she is a runner. Irfan has been known to sneak into the coaches area because he was a runner. That's how involved he gets. So very hands-on parenting. So I think it's time. That was our non-negotiable. We had some really interesting interactions. We didn't think our lives would cross that much as an oncologist and as a gynecologist, but we both actually have taught each other a lot, not only personally, but professionally. And so I want to talk about two specific instances. So I did some work with the White Dress Project for advocacy for fibroids that disproportionately affect minority women. And because you get to, he travels with me sometimes and he gets to see my other work because it's so different from what he does. And he got to listen to some prolific stories of women sharing the negative impact on fibroids. And fibroids are usually benign tumors that can cause bleeding, infertility, pain, and not a lot of advancements have been made up until very recently in fibroids. But you used to think you're a cancer doctor. Mm-hmm. So when you saw a mass and it was a fibroid, you were like, oh, this is good news.
Yeah.
But then you said to me at this conference, I'll never forget, you're like, I'll never tell a woman again, oh, it's just a fibroid.
Right.
Do you want to share what happened?
Yeah, I think, fibroids, yes, it's benign. That's great. It's not cancer. But a lot of these fibroids can bleed very badly. And that's how they wind up in my office, is because, years of bleeding heavily, they become very anemic, they become iron deficient. And we do a lot of iron infusions in our office, which can help them feel better very, very quickly. And it is gratifying to do that. And someone who comes in eating a ton of ice, weak, tired, can't be present for their own family, you give them a couple of doses of iron, and then literally in a week or two, they're feeling significantly better, and they're able to get on with their life again. But that's kind of the first time that we had a crossover. It was like you sent me a patient that was profoundly anemic. But I think taking care of that fibroid is also obviously critically important, so they don't have to keep coming back for more treatment in our office. So.
And you heard that story of a woman who became suicidal because she had infertility, and her husband ended up leaving her. And so she felt like she had lost the opportunity to become a mother, but then she also lost her relationship.
Absolutely.
And so when you see the implications of a non-cancerous tumor, I think it really changes your perspective. Like, you weren't being dismissive when you were like, oh, thank God it's a fibroid. You were like, almost like, thank God it's not uterine cancer.
Right.
The other day, I was talking about how 9 out of every 10 female cancer patients struggle with some type of sexual dysfunction, but only 1 in 10 have it addressed despite ASCO guidelines. And ASCO stands for the American Society
Clinical Oncology.
Yes. And they tell them, but they're so busy talking about the data and the treatment and what's going to happen and having family meetings. But Irfan got really good about addressing sexual health concerns and helping patients anticipate. And so they were kind of shocked, right, that you would do that.
Yeah. Well, I think, the learning I did at home by absorbing things from you, going to some of your talks, meeting some of the people that you rub elbows with, it was definitely eye-opening for me because historically, when someone has beaten their cancer, survivorship, we pat each other on the back. It's like, all right, great job. Go on and live your life. Your cancer is cured.
Survived.
It's amazing.
Yes.
Meanwhile, the treatment that we did to get there wreaked so much havoc. Their sex life is destroyed. Their menstrual cycle is destroyed. They don't feel well. Yes, the cancer is gone, but their lives are permanently, or in their eyes, permanently destroyed. And I think that's where survivorship is so important. And what I learned a lot is about the benefits of estrogen, which in oncology, if you're not aware, is kind of a taboo term, because for years and years we thought, well, estrogen is one of the causes for breast cancer. It's definitely been implicated in breast cancer if you have the right genetics or family history. That's definitely true. But I think estrogen still has a role after beating breast cancer in many, many women, not all, but many, where it can be life-changing. And that's what I learned. But it's historically, many oncologists to this day even think, well, you beat breast cancer 7 years ago, estrogen should never be on your radar. But meanwhile, estrogen is what you may need to feel better. So it's been eye-opening for me and many other oncologists as well, I think.
And the WHI, a lot of the data, they did not share that in the estrogen-only arm, the women who developed breast cancers actually had much lower mortality, and they had a decreased risk of developing those breast cancers. And so, and localized estrogen therapy, a lot of doctors, including myself, believe almost every single patient is a candidate for that, to prevent urinary tract infection, sexual pain, vaginal dryness. And so really, I think oncology is coming around, and we are understanding the data better. And there's more and more data to actually support hormone therapy for cancer patients. Obviously, each individual
Individualized case,
and
right.
tumor type and estrogen, whether it's estrogen receptor positive, it's a discussion to have, but it's no longer an absolute no, like the both of us were taught. But I think the other funny story that you have is you were talking to a patient the other day, and we never got to actually finish it because currently in this country, there's one trained menopause provider for every 32,000 patients, because as women are living longer, and this is something that we weren't trained in residency, and all of my training came later. I joke, on my own dime and time. But what did she say to you? You were talking to her about the effect she was going to have from her treatment. And she was like, how do you know so much about menopause?
Yeah. Well, yeah, I was talking to a patient about some of her effects that we would be creating from her treatment. And I went through this kind of whole spiel that I learned through SOMI. And I created a menopause spiel for the oncologist perspective. And she was kind of surprised because she had actually seen a different oncologist, and I was a second opinion. And she had never, heard it at that level from a medical oncologist. So it was great. I thought I've learned so much about menopause and how it factors into oncology, and using that data that I've learned from SOMI. This is what we've taught each other. Has actually helped me counsel my patients even better. So it's been eye-opening for sure.
Oh, all right. So we've talked about kids. We've talked about home. We've talked about how we've helped each other with our careers. Yeah. It also helps sometimes for me, like quickly, hey, I need an onc consult, and those can take weeks, and I get advice from him. But what's one thing that most listeners would never guess about me, either from home, from clinic, or travel?
I think one thing that people would not know about SOMI is, on stage, she's well put together, always looks the part. But at home, she is, we like to call her the tsunami, the SOMI tsunami. She is, let's just say, a bit messy at home and disorganized. Amazing mother, amazing cook, cooks amazing meals for us. But the kitchen after she's done is like a war zone. And I'm a neat freak. So I guess it works out well in that scenario where I come in and clean up everything. But sometimes I'm shocked when I see you on stage. I was like, oh my God, look at your bedroom. The closet is destroyed, but you look like that on stage. It's pretty amazing.
No, and I can plan a trip. Like, I execute business plans. Like, I get it done, but there is a aftermath, like a zone of just chaos. Yeah. And I don't think people would ever guess that creativity and that all of that. And the business, everything. Like, I started my business in a notebook. Like, my lists.
Yeah. There's a list for everything.
All over the house.
There's a list there might be a line item on a list, find list from last week. It's crazy the amount of lists she has. But it does work. I mean, I guess if we each have our way of keeping our life organized. And it is satisfying to check something off a list when it's done. So I do get that.
I think for me, if it's manifestation, if I write it down, it's going to happen. Yeah. Everything that I have ever written down, including starting my business, landing certain podcasts, landing certain deals, like if I've written it down, it's happened. So for me, it's manifesting. It also keeps me organized. End of the week ritual. What is something that we do to say we survived, a meal ordered, a cooked? Like what is our end of the week?
I think when we survive the week, we're both off on a weekend. A date night is critical. I think we do go on a lot of date nights. And I think for me, that's a nice way to finish the week. We don't see each other a lot during the week sometimes.
People joke that that's the secret to
that is a secret to there's truth to that, I think, to some extent.
Because we miss each other.
Distance makes the heart grow fonder, I think. But no, I think date night at the end of the week is amazing. We go out for a nice meal. We have a bottle of wine or a glass of wine. And we can just kind of wrap up the week and just talk and see, hey, what's going on? How have you been? Just to do the basics of marriage, sometimes which get thrown by the wayside when you're so busy. But I think that's what I look forward to at the end of the week is our date night. And then travel. We love to travel, as you've heard. We've been to many places together. Travel is something. The love of travel is something we both share. So I think talking about our next adventure, figuring things out, half the fun of travel is actually organizing the travel or setting it up. So it's been great.
Yeah, I mean, traveling, you learn new things together. You experience new cultures together. We're both foodies. Yeah. We love food. And so I think that's what's really, really important to us. So what's one belief about marriage and medicine that you think people should retire and replace it with?
The traditional marriage about 9 to 5 life and 2.3 kids, a dog. I think there is something to that. You can't just have all work and no play. I think, you work hard to be successful and create a family and get the financial freedom that you want. But I think you have to take time to smell the roses. We often get so caught up. We're both super driven in our jobs, in our work life. Is it creating that balance is important. So, I feel like that's probably what I've learned over the years is that work is work and home is home, and home is the safe place where you should be able to talk to your spouse or your family about anything. And we are super close and tight as a family, but I think that's something we created together. I think that's so important. I feel like that's where many doctors and professionals get so wrapped up in their work that they forget about the home. And I think finding that balance is important.
Yeah. And speaking of his picket fence, 2.3 kids, because we do have 3 children, 24, 19, and almost 17. And then we do have 2 dogs because as an OBGYN, I found out that I like to bring living things into the home. We had a diapered dog at one point, but our latest addition was kind of thrust upon Irfan. We had gone to a puppies and yoga class and they had Frenchies. And unfortunately, we had lost our Frenchie last year and had to put her down. And the week before at a farmer's market, I had seen a Frenchie and I was like, I think it's time for another one. And then I got him in a weak moment on a Sunday. And by Tuesday, a new Gus was being delivered to our house. So Irfan has learned that if he gives me a little bit of room, he's like, you're the only woman in the world I know who 48 hours later found a dog and it is now being delivered to our house. Yeah. But what happens? He fights it the worst. And then who does the dog usually love the most?
Yeah. I mean, I'm a dog person. So, it was something that we didn't need at the time. But I think, it turned out to be a great addition to the family, and he's an amazing dog. So,
oh my God. He's the best. We were talking about this last night at dinner. Describe the partnership that we want for our kids.
Well, I think our kids, they grew up in a 2-physician parent household. I think they saw how we made it work through tough times. They saw that we weren't always present because of our job.
And they got exchanged in garages at the hospital when one of us was off. Yes.
Yeah. Car seat handoffs in a hospital garage. I
don't know how many au pairs and babysitters we've had. Yes.
Multiple au pairs and people who've helped out over the years because our parents weren't, close by. So, I think what they have learned is we figured out how to make this family work. And now hopefully they can use that knowledge to make their future families work. And I think, seeing a 2-physician household in the crazy schedules, I don't think it gets any more difficult than that. And hopefully they can take that knowledge and use, or that experience, and use that to kind of create their own family unit, and make sure that they use the tools that they have to make their families run like we made ours run.
I think for me, it was 2 things. It was, we both treat each other in a manner that I want them to be treated in their relationships. I firmly believe Irfan watches people die young or too early, and telling people now while you're alive, like how you feel about them, whether you're upset with them, whether you love them, whether you're happy. So being very expressive. I believe in YOLO. You only live once.
Yes.
But I think one of the cutest moments ever was our 25th wedding anniversary party, and the kids gave speeches, and I was actually shocked at how much they absorb. And Maya talked about how one of her favorite things is when she sees her parents like dancing in the kitchen. And so that's what I said. It doesn't have to be fancy, but sometimes after we'll cook a meal, and there's great music on, because there's usually music playing in our house. And it's another way we let the day go. They'll catch us like dancing in the kitchen. And I would say, so what is 3 moves? I'm going to give 1 move for dual power couples: 1 conversation, 1 ritual, 1 non-negotiable. So for me, it's like, I feel like I give so much to the kids, to my parents, to my family, to patients, to what I'm doing, that I like to be pampered. I like acts of service. And so the one thing that this gentleman does every day, no matter what, is he'll either bring me a cup of coffee, or we have a coffee maker that is programmed so that when I go down, the coffee is ready for me. And so he's sending me a cup of coffee, even if he's at the hospital. And so that little act of love reframes my entire day. And so what's your 1 power move that you think a couple that has a dual career should do?
I think there's multiple, but I feel like when you're needed, you should be there, because it's a union, it's a relationship, and there's hard times, and there's many great times, but there's many hard times as well. And sometimes the hard times come when it's not convenient for the other, but you got to carve out a way to be there. And I feel like we should always be there, and we have been. We should always be there for each other and for our kids. And I feel like that to me is like a non-negotiable. I mean, if our kid calls and he's having some type of emergent problem, that we need to drop everything and be there for them at that moment. And same for your spouse. I feel like that's part of keeping the family together, is being there for each other, and being able to have that, being able to rely on someone. I was like, that person will always have your back. I feel like that's really, really important.
So on that note, always have each other's back. Thank you for listening today. If this helped you feel seen, share it with a couple building something hard and worthwhile, because I firmly believe if it's worthwhile, there's no easy road. Subscribe to The Disruptor and tell us the ritual that keeps your house running while life gets really loud. Follow, subscribe, and comment your answer below. Thank you so much. Thank you, sweetheart.
Thanks. That was fun.
See? I didn't kill you.
No, you didn't.